The pharmacist should definitely be a part of your healthcare team because we know the disease states and we specialize as well. And so we can break down the information that your provider might not be able to do. You go to a specialist, maybe they don't see what you're taking and they can prescribe you something that interacts. Thankfully, the pharmacy can catch that. If you have a uterus, you need to be on progesterone if you have estrogen because estrogen makes the lining grow. If you have something that grows, your uterine lining, you need to protect it. Progesterone balances estrogen. One is the fertilizer for your plants. It makes them grow and beautiful, but we need a lawnmower. We need to cut the weeds. That's progesterone, keeps the weeds out. There are side effects to everything, and you need to know what are the potential risks versus benefits of taking this medication. But don't just take a chemical and put it in your body without asking questions. Okay? What's the side effect? You're going to blow everybody out the water. You're going to be bloated. You're going to be uncomfortable. God created us so specifically, y'all. Everything works together. And anytime something is not in its purposed place, there's going to be an imbalance somewhere else.
MenoTheSis, her heartbeat is the power of the world. MenoTheSis.
On this episode of MenoTheSis, we are honored to welcome Dr. Jessica D. Johnson, PharmD, a board-certified ambulatory care pharmacist and founder of Reset with Dr. Jess, for an informative and empowering conversation about menopause, medications, hormones, and becoming your own health advocate. With more than a decade of experience in women's hormone health, Dr. Jess combines clinical pharmacy expertise with relatable, compassionate education to help close the gap in hormone health literacy. Through Menopause Prep Academy and the Hormone Reset Society, she provides women with practical tools, evidence-based information, and community support to help them prepare for and confidently navigate the menopause transition. In this episode, Dr. Jess helps us to unpack some of the questions so many women have about hormone health. We talk about medications, hormone therapy, supplements, common misconceptions, the importance of understanding your treatment options, and why your pharmacist can be the most important member of your menopause healthcare team. Now, ladies, we're excited to share that Dr. Jess will be one of our featured expert panelists at the 2026 inaugural Menopause Awareness Summit, where you'll have an opportunity to hear more from her and our multidisciplinary panel of women health experts. Now, if you haven't purchased your ticket, you can go online to bhforwomen.org in our events tab and click on the Menopause Awareness Summit and purchase your ticket. The date is October the 3rd from 11 a.m. to 3 p.m. Dr. Jess will be there along with all of our expert panelists and can answer any questions you have in real time. Now, Dr. Jess is also known for her signature message. It's not you, it's your hormones. She is helping women replace confusion with knowledge and approach to midlife health with greater confidence. If you ever wondered what your hormones are doing in your body, what questions you should be asking about your medications, or how to become a more informed partner in your own healthcare, this conversation you don't want to miss. So ladies, we would love to see you at the summit. Happy hormones.
Hey girls, hey! Welcome back to another episode of MenoTheSis, where the pause becomes your power. Now, as we count down to our 2026 inaugural Menopause Awareness Summit, we're introducing you to our incredible experts who will be joining us on the stage through our special series, Meet the Summit Speakers. So today, I want to introduce you to a fabulous lady, and this is Dr. Jessica Johnson. She is a clinical pharmacist, And Dr. Jess will be on our panel, and she will be giving all the ladies the information on hormones, HRT, what to expect when your hormones start to shift. And ladies, menopause is for women in their 30s as well. So ladies, Dr. Jess is here to bridge that gap from her demographic, 30 to 40-year-old women that should be aware of menopause. So I'm your host, Dr. LaShonda Bailey.
And I'm your co-host, Veronica.
And hey, girls, hey. So let's get this thing started,
Yes.
Dr. Jess. If you want to introduce yourself and just tell the ladies exactly what a clinical pharmacist do, how is your role different from a pharmacist, say, in
Publix or farmers, yes.
Walgreens,
Yeah.
and what we usually see in the pharmacist, and why should menopausal women consider having a pharmacist as part of their healthcare menopause
Yes.
team? Because
Mhm.
I personally think a pharmacist is very important to have on your team.
Mhm.
So let us know a little bit about that.
Yeah, sure. Well, thank you both for having me. I'm excited to be here and to get to talk about what I get to do and what I love because it's hormones
Yes.
and menopause. But I'm a clinical pharmacist, and that is just a fancy term as I did extra training after pharmacy school. So I have my doctorate of pharmacy and my PharmD. And after pharmacy school, I did 2 years of residency. One was general, one was specialized in ambulatory care. So when you go see your nurse practitioner, your primary care provider, you're talking about your chronic health conditions. I specialized in that.
Okay.
And then within my career, I went right into managing women specifically veterans.
Mhm.
So I worked in the VA system for 11 years.
That's amazing.
Yeah,
That's
it's
amazing.
very rewarding and stressful too.
Right.
But in that, I'm able to actually prescribe medications. So
Okay.
a clinical pharmacist, from my perspective, working in the VA, I have a authority to prescribe medications,
Okay.
order
Okay.
labs, respond to labs,
Mhm.
things of that nature, place consults. So mid-level provider, like a nurse practitioner or a PA, I just don't diagnose.
Okay.
And that's within the VA sector. In the civilian sector, there are clinical pharmacists as well. They usually have a collaborative practice agreement with their provider, so
Okay.
they can prescribe under their provider, similarly to what I was doing in the VA, but maybe a little more limited scope.
Okay.
It depends.
Well, thank you for that, because
Yeah.
that is very, very informative. I think having a pharmacist on your team is very important because, like I was talking to Veronica before, last week I had a sinus infection
Mhm.
and I went to the pharmacist to pick up medication. So I had an antibiotic, but I also have a medication that I'm prescribed so I can sleep because insomnia is bad.
Mhm.
And when I was getting my medication, I'm filling my prescription, the pharmacist stepped out from the back to speak to me.
Mhm.
And she said, I just want you to be aware that this sleep medication reacts differently with this antibiotic. So taking both of them together, you may want to space it out. If you can,
Mhm.
after you get off the antibiotic, then you can go back on, the
Holding
sleeping
it, yeah.
pill or hold it or just space it out. So I think that is so important and informative to have you guys on our team
Yeah.
because I went to the urgent care. The urgent care does not
They don't know your history and
my
what you're taking.
history.
Yeah.
Mm-mm.
Yeah.
And that's the thing about pharmacy is we are doctors of medication, how your body responds to medication and how medication responds to your body. So we might not diagnose you, but we have guidelines to say, oh, your blood pressure is this consistently. You most likely would benefit from lifestyle plus potentially this medication. We also know how the medications are going to interact with each other. So just like the pharmacist pulled you aside to say
Right.
this and this can cause this response, your doctor has 10 minutes to talk to you and get you out the door, whereas we can be pulled from the side at the pharmacy. Now, it's a little hectic in retail pharmacy. Kudos to my retail pharmacists because I was not built for that. But we're accessible.
Right.
So even as a clinical pharmacist, I had 30 minutes with patients, sometimes an hour.
Oh.
Wow.
Whereas the provider had 10, 20 minutes to see the patient. And I was taking over managing things that they couldn't get to, or it was more complicated and it need more in-depth management.
Okay.
So the pharmacist should definitely be a part of your healthcare team because we know the disease states and pharmacists specialize. There's pediatric pharmacists, like I do women's health.
Mhm.
There's oncology pharmacists, there's cardiovascular pharmacists. We specialize as well. And so we can give you the in-depth information and give you the time that you need and really break down the information that your provider might not be able to do. And we make sense of what your provider is saying because we also have that clinical medical knowledge to work as peers with your providers to be able to bring that information to you as the patient.
You hear that, ladies? I think that is a wealth because when you think pharmacy, you think in the pharmacy, you want to stop, pick up your medication. You don't think having an actual consultation, having an actual conversation.
Yeah.
That is powerful and I love it.
Yeah.
Welcome. I'm glad you are part of the Beating Heart Health Menopause team. And I love it. Veronica, do you want to dive into some questions for Dr. Jones? Because this is amazing.
Since we're on the topic, I want to know, why is it important for women to understand every medication that they're taking?
Oh, why would you take something you don't know what you're taking? You know, so I'll give you this example. I went to the doctor and my A1C was pre-diabetes range.
Right.
I had not been working out. Was not eating right.
You're right.
Okay. The doctor didn't ask me about my lifestyle. How was your exercise routine? How's your diet? How's your sleep? They just said, here's a medication. If I were someone who was not knowledgeable to ask questions, then I would have just taken that because as a patient, you respect your provider's recommendation. But that medication can cause stomach upset, diarrhea. It impacts different things within the body. And I'm just going to take it because they said so. And then I have a side effect.
Exactly.
And then I'm like, oh, I don't know why I'm feeling this way.
Yes. If you're talking about metformin, I know.
Yeah.
Yes.
Yes.
Correct.
I'm trying not to say names.
I can say it.
Yes.
And it is all the side effects, all the things.
But your provider can't counsel you to say this is medication might cause this.
Right.
And then if you don't know what you're taking, say you go outside of your prescribing provider, you go to a specialist. Maybe they don't see what you're taking and you're not writing it down or have it in an app or something like that. They can prescribe you something that interacts. Thankfully, the pharmacy can catch that. But what if your medication you're taking from somewhere else is at a Walgreens and it's not at CVS, that you're going to CVS and now we're interacting.
Right.
And be aware of what you're putting in your body so that you can know what questions to ask because there are side effects to everything.
Right.
And you need to know what are the potential risks versus benefits of taking this medication. And if you understand that, you can say, oh, well, I can actually change this part of my life where I don't maybe need the full dose of this medication, or I can use it for a certain period of time and then come off of the medication, or I need to be on this lifelong, but here's how I can support myself to actually benefit from it the best. But don't just take a chemical and put it in your body without asking questions.
Great advice.
Actually, it's very, very good advice. And I want to extend on that just to share an experience that I have. So, I have a spine neurostimulator device implanted in my back. My leads run up my spine. For those who don't really know what it is, I call it a spine pacemaker. That's not the term.
Good, it works.
What I call it.
It works.
So I started getting really bad migraines. I mean, I've always suffered from migraines since I was a teenager. I still get them to this day. And I am diabetic. So I also take Mounjaro. And right around the time the stimulator was implanted, I had to stop the Mounjaro for a bit and then it started up.
Okay.
So in my head, right, I'm telling myself the Mounjaro is giving me migraines and it's making me dizzy and it's making me feel like I want to fall, right? I call them brain zaps. And
it was something else happening.
And I keep saying this. So I said, you know what? I do take a lot of meds, but I've been taking, let's say, these 9 medications on a daily basis for this long. I just started back up the Mounjaro. I'm not even thinking that a stimulator device would ever cause any issues. So I'm automatically blaming the Mounjaro. I go to my doctor. We talk about it. And I said, listen, I don't want to take it no more. Can we space this out? Like, I don't want to do this. And then he's like, okay, fine. Let's space it out. We start that. And then I'm like, wait. It's happening. Why is it still happening? I'm not taking these meds no more. So then I started complaining to my reps for my device. And then one of them just said, turn the device off. Man, I turned the device off.
It
Stop.
went away.
Wow.
And then in my head, I'm like, I'm blaming this medication for the longest while.
Even your doctor,
Even
is
my doctor
signing with you.
co-signing.
Because your doctor's like, well, they're complaining about a side effect. Headaches are a side effect of all medications.
Exactly.
Okay, you drink water, the side effect is headache.
Right.
So,
Yes.
and so it's good that your provider is like, okay, well, let's try it out. If you feel it's this, that's one thing that we do in medicine. If we think something's causing a problem, let's remove it. Let's space it out. Let's lower the dose. Let's see if the response stays. But that helped you to tease out what was actually the problem. So
that's why I definitely agree with Dr. Jess and why it's great to keep a journal if you have, especially if you're someone who takes a lot of medications like myself. So you can document exactly what's happening on a daily basis, especially when you're trying something new. Okay, first day I had a headache. This day I felt fatigued. Like you would have a better idea as to what's going on. So journaling is a very good thing to do because it allows you to keep track of the symptoms, the side effects, and everything that's going on when you start something new. So you'll be able to, like she said, weed out what is causing the issue and what's not causing the issue. What's working and what's not working.
I agree. I think journaling is important because when your body starts to change and you're asking yourself, is it menopause or is it me? You can actually have a journal to say, this symptom happened. This was different. Because my first symptom was brain fog.
yeah, that's usual.
And it's like, what is that? And when you say it to the doctor or you say it out loud, it's you're getting older. You're forgetting. But it's a different type of brain fog. It's almost like bad internet trying to connect. So I think having a journal, just keeping a note, this happened. Then here goes the hot flash. I can't sleep at night. I've gained this much weight. So I think that is very important. So speaking of hormones, Dr. Jess, I need to ask. I remember being terrified of hormone replacement therapy because I have a sister that passed away with endometrial cancer, right? So everybody knows my story. That's how Beating Heart Health for Women was birthed. Because when I approached it as a researcher, naturally, I am seeing articles, HRT ties to breast cancer. Uterine cancer, endometrial cancer. So it's just like, oh, I had all the red flags going. I was like, I'm not doing it.
Yeah.
So I ordered everything from Amazon that you can think of. I've researched black cohosh. Ashwagandha.
I love
Ashwagandha.
from Amazon.
Yes.
Oh, Jesus.
I've had Remington. I've had Ambien. I mean, and I'm not saying that you can't get those supplements because they work.
They do.
They work until they didn't work. And then the cycle is over again. So I got to the point I was like, listen, I have to get to a point where my quality of life was like a yo-yo. My husband was suffering. My marriage was suffering. My relationships with other people was suffering because that hormonal wave, I was spazzing out on people. They may have deserved it, but it was more frequent than often. You know what I mean? So I want to specifically ask, why is there so much fear surrounding hormone replacement therapy?
The media.
The media.
The media. It's the media. So there was a study done in the late 90s, early 2000s called the Women's Health Initiative Study. The study was actually beneficial because it was looking at how we can prevent chronic diseases, cardiovascular disease in women and older women utilizing hormone therapy. Now, when they put that information out, they saw in one arm of the study that more women were having breast cancer diagnosis. When I say more, 8 more than the other group. So 30 out of 10,000 who were on placebo had breast cancer. 38 out of 10,000, I believe it was 10,000, were having breast cancer.
Right.
So not statistically, mathematically significant.
Right.
Not downplaying that you were diagnosed with breast cancer, but
Correct.
they also didn't look at the risk factors for breast cancer in that group. So people were still smoking, people were still drinking, people were overweight, people had a family history of breast cancer. So they didn't take into account those factors that we do now. Right. We did it then too. And then the media took it and said, oh, these hormones cause breast cancer. Stop the study. They were 3 years from finishing. Stop the study. Take everybody off of hormones. And thousands of women were abruptly stopped from hormone therapy because now providers were scared and patients were scared.
Yep.
And that fear has continued for 2 decades, essentially. And there was a warning put on all hormone therapy for the risk of cancer and blood clots. And so that blanketed risk then put more fear into providers as well as patients when they read the black box warning. And they recently removed, as of last November, they removed the black box warning from menopause hormone therapy. It's still for contraceptive, so birth control, which is synthetic hormones versus nothing wrong with synthetic hormones, but the treatment is different.
Right.
It's a different type of hormone, a different type of indication. But now we just have in our brains hormones, cancer.
Correct.
And I've had patients come to me and I'll break down the study and I'll tell them your risk is low for breast cancer. You have no family history for breast cancer. All of your mammograms have been normal. You drinking wine is going to give you a higher risk than you having hormone therapy. You being off of hormone therapy actually increases your risk because in the study, they found that women who were on estrogen only had a lower risk of breast cancer. So estrogen therapy had a protective benefit for women. But the media put that out there and they ran with it and putting it out to the information. This is a little bit in the weeds. Okay. So a group of the study investigators said, we're going to put this information out. The entire group said, no, this isn't correct. All right. Like 10 out of 40 said, we're going to put this out. So they put it out. The big group said, take it back. They went to the media. They said, we already printed it, but we'll put something else out after. So the headline is hormones cause cancer.
Yes.
But if you read it, the information is not saying that hormones cause cancer, but nobody's reading that. They're reading the headline.
Exactly.
And then they put some information out afterwards to say, oh, actually, we don't see a statistical cause, blah, 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 blah. But nobody read that.
It's too late now. You implanted that seed in my head. And I'm
exactly. I'm glad you cleared that up because I know the study and I had to go and dive into and look at the evidence-based articles and journals because that was the fear.
And they weren't even treating menopause.
And which demographic of women were in the group? How many were in each segment? How many were in different categories? Because we do know that race and ethnicity affects data set.
And even the women that were studied were beyond menopause. The majority of them were postmenopausal, and you have a higher aging is a risk for cancer.
Correct.
And so we took the information of studying cardiovascular benefits and applied it to managing menopause symptoms. And that's not even what was studied. And the women were, because they couldn't give you hormones if you're having hot flashes. We're going to know that it's working. So they couldn't do that. But we just applied this information to the wrong population. And just like you're saying, it was not a full representation of women in society.
I'm glad you cleared that up because that is a whole misconception too, because I do know that there are doctors that still to this day will not prescribe hormone replacement therapy. And I will say from someone who came from fear versus now me being on hormone replacement therapy, I see the biggest difference for my quality of life.
It's huge.
It's huge. And it's just about that little piece of information that Dr. Jess just broke down, reading the article in its totality and getting the knowledge and not just running with the headline. Because so many women are suffering. I see them with a hot flash or suffering. You tell me you gain weight, you can't sleep. And I'm just like, okay, sis, what you going to do about it?
And the thing is, the study didn't even utilize the hormones that we prescribe now for menopause. It was medroxyprogesterone and equine estrogens, which come from pregnant horses' urine. And that blend of estrogen, there's multiple blends. Some of our body uses, some of our body doesn't. But it's like a proprietary blend. And we'll talk about, when we talk about supplements, proprietary blends. But you've lived with hormones. Listen to me, y'all. You have had hormones in your body your entire life. Okay. You were born with them. You're going to die with them, but maybe just not as much. So replacing them with menopause hormone therapy. And I use that differently than hormone replacement therapy. It's different. Or contraceptive therapy. You've been living this your whole life. You've been fine.
Exactly. Because if you're losing estradiol,
Yeah.
and you had this hormone in your body to balance you to function, and you get a certain age and it drops, how are you replacing it if it was beneficial for you to have in your body already?
Right. Yeah.
So I'm glad you are clearing up a lot of the myths, because I was going to ask you. And that was one of my questions. What are some common myths? Thank you, Dr. Jess.
Yeah.
What should women ask before deciding whether hormone therapy is right for them? So I want to specify, because you have told me that. Menopause hormone therapy.
Yeah. So that's the question. Is this right for me? So you're going to go to your provider and say, give them your family history, give them the medications you're taking, give them all of your symptoms. I educate women to go in with everything. Like you mentioned, a journal. I have like a little spreadsheet that you can check off your symptoms and take it with you to your provider, versus one-offs. I can't sleep. My mood is down. I'm gaining weight. If you just give them one of those, that's all they're going to focus on.
Okay.
Then you'll talk about cancer history. What are your risks for cancer? If you have a uterus, you need to be on progesterone if you have estrogen, because estrogen makes the lining grow. If you have something that grows, your uterine lining, you need to protect it. Progesterone balances estrogen. One is the fertilizer for your plants. It makes them grow and beautiful, but we need a lawnmower. We need to cut the weeds. That's progesterone, keeps the weeds out. Talk about headache history of migraines, because synthetic hormones migraine history, especially migraine with aura, is an increased risk for strokes. And if we give you synthetic hormone, that's also an increased risk for stroke. So we don't want to do both of those. Menopause hormone therapy is not the same.
Okay.
And so if you have migraines, talk to your provider, because you can be on menopause hormone therapy. And talk about your life goals. Where do you want to be in the next 30 years? Do you want to be frail? Do you want to have high cholesterol? Do you want to have high blood pressure?
Right.
How is menopause hormone therapy going to improve or impact your health span and your lifespan? Whatever your goals are for your health, can menopause hormone therapy help me reach that goal?
Right.
And if it can, it might be an option for you.
I love it.
Yeah.
I love it. Veronica, you have some questions? Because this is so informative. Oh my God.
I get talkative about hormones. Sorry.
So am I. I am talkative and passionate about hormones, because women, we need to feel well.
Yeah.
And a lot of women are afraid.
So you were just talking about the medication, and we were talking about journaling and how you could help women to start preparing for that appointment. So I want to dive a little bit more deeper into that, and what laboratory tests are important to discuss. How do women prepare for their appointment?
So there's a scale called the menopause rating scale, and I'll give you my link. You can use that. It's a validated screening tool, and it gives you your score of how bothersome your symptoms are. And it looks at the majority of symptoms that you would experience as your hormones are shifting. You can do that scale and take it with you to your provider. If your provider's like, I've never heard of that, then we can talk. I can tell you how to explain it to your provider. Okay. But take your full scope of your symptoms. That's why tracking your symptoms over time is going to be beneficial, because if you're perimenopausal, you're still cycling, you're going to have a pattern to your symptoms, or you're going to start to see that that pattern has shifted. So taking in, am I still having a cycle? Is it different? Is it more painful? Is it lighter? Is it more spread apart? Am I having more PMS symptoms? Is my sleep disturbed? Am I hating everybody and I never hated everybody? Am I depressed? Am I angry? Am I hungry? Am I thirsty? Because you get dry mouth and dry eyes. All of these things you want to bring that to your provider.
I had an aha moment. They was like, what?
Yeah.
That's what MenoTheSis podcast is for.
Yeah.
The ahas.
But you wouldn't even think to associate that with hormone changes. Yeah. And then bring in, what medications are you currently taking? What supplements are you taking? Because you went on Amazon.
Yes.
And ordered everything that you researched.
Yes.
Yes, ma'am. Yes, ma'am.
So bring what supplements you're taking, and if they're helping, right? So if they're helping and they're not impacting your medications, you take it, right? And then bring in your goals. What do I want to do? I'm suffering right now, but how do I want to feel?
Yeah.
Right.
Bring that to your provider.
Yeah.
Okay.
And
Love
that's,
it. That is huge.
And to the second part of that question is, what laboratory tests are important to discuss? But I also want to add something in before we jump to that question, because you spoke a lot about someone like perimenopause, right? So I'm in my peri stage.
Yes.
Right? I don't have a uterus.
Okay.
I've had a hysterectomy.
Okay.
So how would I
start hormone therapy?
Correct. So you said, how would I know? Because I'm not
That's a great question.
Yes.
You're not bleeding.
Exactly.
Okay. Okay. And that's a part of I love that, because if you still have ovaries, you still have a cycle, right? You just don't have the bleeding part of your cycle. So your hormones are still going to go through the cycle, which is you have menstruation, then you go into your follicular phase where you make a follicle or an egg, you ovulate, so you release that, and then you go into your luteal phase, which is the last 2 weeks of your cycle. How you present during those phases are different. Follicular phase, you'll have more energy, and that energy starts to continue to increase. When you get to ovulation, you have high energy, you're confident, your skin is glowing, you feel great, your mind's working, your communication skills are great, you feel really good. Then you start to have a decline in energy. You get more hungry, maybe a little more tired, more fatigued. Things get drier during that time frame, and you can trend that every third week. I'm angry, I can't sleep, heart racing, my mouth is dry. That is your luteal phase. Put that on a calendar. Or I feel great. This is a good week. Everything's great. Put it on a calendar, and you'll start to see how this is trending consistently. Or with perimenopause, you'll start to see how this is becoming more inconsistent. So you need to monitor your physical, mental, emotional symptoms versus a bleed.
Okay.
Does that make sense?
That makes a lot of sense.
Okay.
Okay, so let me just throw something in before you add. Okay, I am post menopausal.
Yeah.
So I haven't had a cycle in about 400 days.
Okay.
So how does that, for the postmenopausal women, when you explain that process, can you explain our process being in post?
Yeah. So postmenopausal, you have more consistency in like moods and energy, whether that energy is low or you're not going to have those fluctuations like you're on the roller coaster.
So if you're low, you're consistently low.
Yeah. So even in postmenopause, if you're within your first 5 to 8 years, you're still going to have some fluctuations. So that's why you might notice more hot flashes than, they're less, but they're still happening. I've even had some newly postmenopausal women still maybe have a little bit of a cramp or something like that.
Okay.
But your first 5 to 8 years is very new postmenopause, right? After that, then things are much more calmer because the ovaries are no longer like your just baseline is staying consistently low. Okay. So you don't have those fluctuations, but what you do want to monitor is your weight. You want to monitor your blood pressure. You want to monitor your mood, your energy, your sleep, because your sleep is disrupted it's been disrupted in perimenopause. And now it's going to be more consistent.
Okay.
Some things get better, right? Yeah, because you're not on that roller coaster anymore. So you're not having that chaos of hormones that impacts the brain. So it's like mental fog, that brain changes that happen in perimenopause. They do start to get better.
Okay.
So you kind of come back to your cognitive self.
Dr. Jess says, ladies, it's hopeful.
It is
Postmenopausal is where you want to be on this side.
I mean, honestly,
it's almost like this.
Yeah, it's a sigh of relief, but then you
come on, ladies.
But you have to make sure that you're taking care of your health. Yeah. Because now you're at a higher risk of getting sick because your immune system is lower.
Oh my gosh. I just told you I had blood work done. And my white blood cells look very different from when I did blood work 6 months ago. And
she was scared.
Yeah, I was on the WebMD. I was. I was. You already know.
WebMD is actually
I'm
good.
A low hypochondriac.
It's actually good. It doesn't tell you you're gonna die.
It's bad.
Yeah.
Low hypochondriac, it's bad.
Yes.
But I did have a conversation with the doctor, and it was, okay, we need to look at your nutrition. Because I was in caregiver mode. I wasn't taking care of myself. I was, my mom was in a hospital, so I was in overdrive.
Yeah.
And I had a protein deficiency. I'm not eating. I've been overloading on carb. It's emotional.
So thank you for that information. Oh my gosh. Okay, Veronica, bouncing back to you.
I mean, that goes into your question about labs,
This
right?
episode could go on for 2 hours because this is good.
And I won't do that.
Okay.
But so labs.
We can if you're free.
Yeah. I'm clear for
We
y'all,
gotta
baby.
save some tidbits
Yes. Okay.
for the summit.
For the summit.
That's
Yes,
true.
yes,
That's true. Okay. So labs. Everyone's like, check my labs,
Yes.
right?
Yeah.
And there's nothing wrong with getting labs checked. If the person checking them knows how to read the lab.
Okay.
All right. If you're perimenopausal or your cycle is consistent, you need to check your labs if you're looking at your sex hormones. So estrogen, progesterone, testosterone. You can do your follicle stimulating hormone, which is FSH, your luteinizing hormone, which is LH. Those would be your baseline for your sex hormones, just meaning like your things that cause sexual changes or development in your body, not sex. Okay. If you're having a cycle, you need to check them and you want to see how low they are at their lowest point in your cycle, or if there is an imbalance of estrogen to progesterone at the second half of your cycle. So your lowest point is going to be between day 3 to 5 of your cycle. That's why you want to trend your cycle if you can.
Mm-hmm.
Because that's going to give us how low you're dipping, the ratio of your follicle stimulating hormone, how much of that is your brain yelling at your ovaries and your ovaries are not responding as well.
Okay.
If you're in your luteal phase, you'll check your hormones, I believe it's around day 21 of your cycle, to see if there's an imbalance of progesterone to estrogen, because progesterone should be dominant during your luteal phase because that's the progestation hormone. It is what helps you become and stay pregnant. So it's pro-pregnancy hormone.
Okay.
So it should be dominant during that stage. If it's not, that's where we start to see in perimenopause. And this is some of the reason why women get hysterectomies during their 40s. Heavy bleeding, very painful cycles. Very heavy bleeding because estrogen is dominant in the luteal phase when progesterone should be.
Gosh.
And that, remember, it causes the flowers to grow. It causes the lining to grow. You have more to shed.
Right.
Because it's dominant.
Mm.
And so those labs you can check if you are postmenopausal. So you don't have a uterus. You're like, well, girl, where I'm at. Your follicle stimulating hormone above 30 and your estrogen being below 30. The further apart those are, that means your brain's yelling and your ovaries are not listening. And so that we can say, if we can do that once or twice, but if your follicle stimulating hormone's like 100 and something, your estrogen's 10, baby, it's fine. Then you postmenopause. Okay. But providers will check your hormones at random parts of your cycle. And at one point they catch it and you look perimenopausal. And another point they catch it and they look like you're normal. And they tell you, oh, you're normal. You're not perimenopausal. Well, how did we go backwards?
Right.
We didn't. Other labs you want to check are your metabolic labs. So checking your blood sugar, checking your kidney function, check your liver function, checking your cholesterol, your A1C. If you have a history of cardiovascular disease, then there's some other labs we can check, like lipoprotein A or apolipo B. You can get a DEXA scan or a bone mineral density scan. Yeah. I'm not the guideline maker, but I personally recommend getting that in your 40s because you start to lose bone at a much higher rate the closer you get to your final menstrual period or menopause. And 15 to 20%. And then that bone loss continues. So if you don't know your baseline, you're waiting until you're 65. Yep. You're essentially 15 years postmenopausal and you have soft bones or bone loss.
Yeah. So you have nothing to compare it to.
Exactly.
And you can't catch it early.
With autoimmune issues like arthritis.
Yes.
And that
come on. Yes, come on, Dr. We love it.
So many women are diagnosed with autoimmune issues, right? And you typically, of course, you can see that earlier, but you start to see it around the time when hormones change too, right? Because your hormones impact your immune function, like we mentioned earlier.
Right.
And so you have a weakened immune system. And so some underlying things start to show up that were balanced or when your hormones were more regulated or at higher, more abundant levels. So we see a lot of women get diagnosed with like rheumatoid arthritis. Like my aunt was diagnosed with rheumatoid arthritis. She probably would not have had such severe bothersome symptoms if she had been put on hormone therapy.
Well, I have rheumatoid arthritis. And I'm always in the hospital. So
okay.
And I have diagnosed myself with it.
She has.
So
Let me see. Okay. You ain't got
what you just looked at?
Oh,
We can check labs.
where ladies?
We can listen. We can check labs for RA. You can get labs done for rheumatoid arthritis. Okay, so you go get the labs done for that before you start diet. Oh, and then your nutrients. Check your nutrients because your estrogen, your hormones impact your gut health and how your gut microbiome is digesting and absorbing. There's actually estrobolone, which is a hormone that's impacted by estrogen in your gut. And so that can change how well you are absorbing your nutrients, how well you're producing your B vitamins, how well your vitamin D is presenting. And so doing some nutrient labs, most of us are vitamin D deficiency.
Yes. You mean us brown girls.
Us brown girls.
Us brown girls. Yeah.
Really, America
In the home.
in the home because we're indoors all the time.
We don't go outside.
We don't go
We don't
outside.
go outside. And especially if we're hot flashing. We are not
And
outside.
understandably.
Yeah, we're not outside.
Yeah.
I have to tell my daughter that she's 20 and she got her labs back and she's freaking out. She said, Mommy, I said, okay, everybody, vitamin D, don't freak out.
Right.
Okay, that's the norm.
Yeah.
But vitamin D is also a hormone and it impacts your other hormones. Like all of these, God created us so specifically, y'all. Everything works together. And anytime something is not in its purposed place, there's going to be an imbalance somewhere else. Whether it shows up a lot or it's very subtle and it takes years for it to present.
I love that. Okay. We could be here all day.
Yes.
Yeah, I
We
know.
could be here all day. So what I want to specifically ask you so we could get to this, are menopause supplements regulated? And which supplements should women avoid or which supplements do you recommend? Because I see you have
Brought some.
yes, you have
Brought
a
some.
little something over here.
Yeah.
So let us know about what supplements we need to be taking and how we could get additional help.
Yeah. So I'll give you your foundational supplements. I do recommend, let's see where your labs are. We can check to see your B12. We can check to see your vitamin D. There are labs to check your nutrient levels. So at least you know where you're at. And I can order those and educate you on them too, if you wanted to do that. Supplements are not regulated by the FDA the way that your prescription medications are regulated.
Okay.
Right? So their prescription drugs have to get approved to be on the market, meaning there's studies that are done. And we see if this medication killing people, we're not going to put it on the market. Right? Supplements, on the other hand, they can have certifications, but they're not all regulated. So if you want to look at a supplement, you want to look at something that is NSF or National Sanitation Foundation certified, which is a certification that says what's in this is in there. It's not just sawdust and cellulose and gelatin. And the ingredients and the manufacturing processes are legit. Athletes, Olympians can utilize NSF certified supplements. Okay. You can also look at USP, United States Pharmacopoeia, I believe. That's another certifying body. So it'll say USP, it might say GMC, good manufacturing, or maybe GMP, good manufacturing practice. Those are all certifications to say that what is here most likely is here.
Okay.
Right? And then you want to read the ingredients, because if it's something that says proprietary blend, like I mentioned earlier with the equine estrogen from horses, you don't know what's in that blend and how much of it is actually in there. Right? So you're putting the kitchen sink in and saying it's a proprietary blend.
Okay.
Right?
Okay.
And then we can't say that there's enough even in there to get the benefit from it.
Okay.
Okay. Or there's too much in there and there's a risk. And then you also want to read the ingredients. Can you pronounce what is in there? Are there a lot of fillers? Are there a lot of dyes? Don't use those. You're just putting more chemicals in your body and it has vitamin D listed on it. You're not benefiting yourself.
Right.
And then look at where you're getting your supplements from and if they're third party tested. So third party testing, and there's a lot of supplements that are big name supplements that everyone asks about, and they have proprietary blends and they're not third party tested. Does not mean that what they say is in there is not in there, but I can't go to this third party that's going to say, yes, what they're saying is correct. Here is this, where we tested and analyzed what's in it. So you're not just taking the word of the company who's giving you a lot of AI ads,
Right.
you have another body testing.
Okay, I'm going to ask you specifically
Now,
off camera.
Okay.
Yeah.
Off camera. Because I'm curious about that. Okay. Okay. So do you have supplements that you would recommend?
Yeah, so I am partnered with Thorne. You can purchase Thorne on Amazon. You can purchase Thorne through their Thorne website. You can purchase Thorne through me.
Okay.
Get it from anywhere.
Okay.
But the reason I like Thorne is because they're NSF certified, there's third-party testing, there's clean ingredients.
Okay.
Right? And so the baseline supplements that I typically recommend are going to be, let's do labs, because I don't want to give you vitamin D and it's not enough.
Okay.
Vitamin D3, 4,000 I use.
Okay.
Just 4,000 will for sure keep you where you need to be. This is a liquid form because
It's daily.
vitamin D3 out of 4,000 is daily. You might see 225 international units. You might see 10,000 international units. Get your labs checked. Your doctor is going to check your vitamin D. Okay. But this is a liquid form. You take it every day and there's no taste to it. So that's why I really like it. You can just put it in some water or just take it straight up. Stress B complex. So your B vitamins are something that helps with like cortisol and stress and your gut health. And a lot of times we're deficient in different vitamin Bs. So you can do a B complex. I'm being very general because I don't know your labs to say you need a higher or lower dose, but a B complex would be beneficial and it works well with vitamin D.
Okay.
Super EPA is another one from Thorne. It's your omegas.
Oh, okay.
Okay.
Like the fish oil.
Yeah, like fish oil. So this one doesn't have the fishy taste to it. The capsules are easy to swallow because they're usually like huge horse pills. So fish oil comes from fish because we actually get it from what they eat. So you can get plant-based because it's actually plant-based. It's just easier to get it from fish versus from kelp. But I like their omegas, and that's going to help with cardiovascular health. It helps with hormone health, brain health. You want to have those. Okay, so this one you don't have to have. This is called Hormone Advantage.
Okay.
If you are cycling, this has something in it called DIM, D-I-M. Don't ask me to say the whole thing, please. D-I-M. Okay. And also pomegranate and broccoli extract. So DIM helps with your getting rid of excess estrogen. If you are on hormone therapy, when your patches are available, it helps you to actually get rid of old estrogen because your body can recycle it back into the system and it'll produce symptoms of higher estrogen because your body needs to get rid of it. Or you can eat broccoli or cruciferous plants. If you're in your cycle, you're in your luteal phase, I highly recommend doing cruciferous plants and sweet potatoes and salmon. That's going to be your omegas, that's going to be your DIM, and that's going to be the appropriate carbs and fiber to help get you through your luteal phase. So you can't eat your nutrients.
Wow.
Preferably.
Okay.
Creatine. This one's actually really good. So creatine helps with brain. It helps with muscle. All those gym bros were on creatine back in the day, you know, and now women are like, oh my God. I think people are doing creatine now, but it has so many more benefits than just building muscle. It helps put water into the muscle. So you can do it after you work out. So it's going to help with muscle maintenance after you work out. It also helps with cognition. The thing with creatine is there's different doses for different responses.
Okay.
So this is 5 grams daily, but for the cognitive benefits, it's usually like 10. So if you know you're going to have a stressful day, you can do 10 and that will help you get through that.
Is there any protein in that?
Not in creatine.
Okay.
Not in creatine, but in collagen.
Yes.
So
That's my stuff.
collagen. You lose, I think, about 30% of collagen around your final menstrual period. And then you continue to lose significantly more. That's why women, when they're older, they have that really crepey, thin skin. You get bruised very easily, cut very easily. It's collagen. Changes in your hair, your joints, all of those things are impacted by collagen, but we mainly see it through skin.
Okay.
Because that's just the biggest organ.
Okay.
So collagen has protein and it also helps to replenish what your body is losing with a change in your estrogen or your hormones.
Okay.
I put this in coffee every day.
Yes, me too.
It's so good.
Yes.
And it has no flavor to it.
Yes.
It's really good.
When I remember.
Yeah.
Yeah, I just keep them out.
Yeah.
And then this is FiberMend. Fiber is a prebiotic. So it's what feeds your gut.
Yeah.
Your gut microbiome. So if you're not eating enough fiber, this is actually a good one. If you're just starting fiber, don't do the full dose. Listen.
Yeah.
Okay?
What's the side effect?
You're gonna listen. You're gonna blow everybody out the water. You're going to be bloated. You're going to be uncomfortable. And then you're going to say, oh, I can't take this. It makes my stomach upset. No, just start half or maybe even less. Do that for a week, then go up a little bit more until you can tolerate it. But this one's very gentle on the gut. So I like that. And I just mix it in my water in the morning. And then this is the last one. You can't really see this. It's a little packet of magnesium glycinate. This helps calm muscle, calm nerves, calm brain. It helps with sleep and relaxation. I'm going to give you some.
Okay, thank you.
So this you
want
take,
some?
You can take some too. Yeah. You can take it at night for bed. Very calming to the body. This is specifically magnesium bisglycinate. This is the one that can help get into the brain. Because there's some other ones out there, magnesium oxide. Yeah. That's if you're deficient in magnesium. Okay. But your body's going to use magnesium the way it's going to use it. But it plays well with things like vitamin D as well. You can get zinc as well. That's a good one too.
Do you just mix that in water?
You just mix it in water.
Okay.
And it's like a lemony lime kind of flavor. If it's too early in the evening, I don't drink it because I know I'm going to go to sleep.
Got it. Really?
Okay. Okay. That makes a lot of sense.
And you can have that too with the progesterone because my progesterone puts.
Yeah.
Okay.
So that might be able to replace my sleeping pills, huh?
You don't have enough progesterone. Yeah.
Okay.
Or maybe you're not eating enough we have to talk about your symptoms.
Yes.
It depends on.
I'm telling you, I'm eating, but it
depends
might not
on
be the right thing.
Well, and it depends on if you're waking up at 3:00 in the morning or
am.
if you're having difficulty. Oh, okay.
Oh boy.
So you might be having a blood sugar spike too.
I'm up, me and B. We up. We texting. We talking.
I cannot wait to have this conversation at the events because, Lord, listen, how about that? Just 15 grams of protein before you go to bed.
Okay.
Okay.
I can do that. I can commit.
See if that helps.
Okay.
Because you're having a cortisol spike around 235, 237, or 3. That cortisol is your body's like, I'm being attacked. There's a lion in the room.
Okay.
Now your norepinephrine's high, your adrenaline's high, and it's hard for you to go back to sleep because you don't have progesterone to balance that gas. Progesterone is the brake to that gas. And so when that spikes, you're going to be wide awake. And it's typically around that same time.
Yep.
You also have a blood sugar drop at that time and it's more adrenaline. Your body's like, we got to eat. Something's wrong. So if you have some protein before, maybe do some collagen before you go to bed. Then hopefully that can help with that blood sugar spike.
Okay.
Thank you, Dr. Jess.
Yeah.
This has been so amazing. We could talk to you all day.
All day.
And I'm sure
All
the
day.
ladies.
All day.
We're going to have Dr. Jess on repeat, to keep coming back.
I will come back and talk every day. All
Thank
day.
you, because we will talk every day, maybe at 3 a.m. when me and Veronica.
No, we're going to get y'all some sleep. We're going to get y'all
Dr.
some
Jess
sleep.
sleep.
Lord, yes.
So I want to ask if there's one thing you wish every woman understood about medication, hormones, and advocating for their health, what would it be?
Ooh, so my tagline is, it's not you, it's your hormones. And the reason I say that is because a lot of times we feel like we're going crazy. Something's wrong with me. Yeah. And it's not. You're having these changes because your hormones are doing what they naturally do. So I want you to understand that with medications, they are there to support you through this journey, whether that is nutraceuticals or actually hormone therapy. They are not there to be the end all be all, but they're there to be the support. And then in regards to menopause, it's a natural change. Your body was created. It's going to do this. If you were born with ovaries, you're going to go through menopause. Whether the surgeon takes them out, your ovaries, or they naturally retire and pack it up and go on a cruise forever. It's going to happen. So for you to be able to advocate for yourself, you need to be knowledgeable with evidence-based information, because there's a lot of information marketing to women in the menopausal age range, and it's money. You need to make sure that it's evidence-based, clear information. And go into your provider fully equipped. Tell them what you're doing and write it down. Because if you're educated about your symptoms, you can advocate for yourself. And if you advocate for yourself, your provider who may not be trained to manage menopause, because believe it or not, most providers are not trained specifically in managing menopause, and they're still scared of hormone therapy. So if you are educated with evidence-based information, you might educate your providers to help other women as well as help yourself.
Correct. Because that's what I did. You have to advocate for yourself. But even if you have a primary diagnosis, like Veronica, she talks about bipolar. Me, my primary is obesity. Because I've had a bariatric surgery. You have to advocate for yourself because one doctor's telling you one thing, the other. How about everybody? Let's get on one accord.
Yes.
Because I researched this medication. I researched this. This is what I read. What do you know about it?
Yep.
So that's a good way. So you have a book here, I see.
Oh, yes.
Because I have this same book.
Yes.
So great minds.
I feel like it's show and tell.
And tell us about it.
So we talked about the Women's Health Initiative. We talked about that study. And these particular providers go in depth on why that study was misinformation and how estrogen actually is beneficial for your long-term health. If you're not aware, estrogen, if you touch the top of your head and then feel the bottom of your feet, you have estrogen receptors everywhere in between that. And so when you remove estrogen from your body, you are impacting your entire self. So don't go in fearful. Be educated. This book is a great breakdown of that misinformation.
It is.
And the actual evidence that's there. So estrogen matters. We're going to do a book club.
Yep.
And we will read this book.
And we are a part of the book club. We will be there. Thank you so much, Dr. Jess.
Yes, of course.
This has been amazing.
It definitely has been amazing. And this is exactly why we are doing this series. Our goal is to introduce the amazing experts who will be at our 2026 inaugural Menopause Awareness Summit. It's a lot of words, but it's a beautiful set of words.
Yeah.
So make sure you are in the room because Dr. Jess will be there educating women, answering questions. It's going to be an amazing day, an amazing experience, and you do not want to miss it.
Yep.
Okay?
October the 3rd.
October the 3rd, 2026. It's lunchtime. Our ladies, we're going to get cute. Okay. The theme is pink, shades of pink.
Shades of pink.
We love a little pink.
We love pink.
All right. And it's all over our social media.
Yeah.
All right. And as I said, she's the second expert that we have introduced to you guys. We have some more coming. So you definitely want to stay tuned and you want to be in the room. I can't stress that enough.
Yeah.
Please be in the room.
Yes. This was informational in itself. So could you imagine being at the summit and asking Dr. Jess personally in real time your questions? Because knowledge is power. Dr. Jess just said that. So,
and I'm about to ask Dr. Jess some questions too.
Let me add one thing.
Absolutely.
Ladies, if you're in the menopausal range, you have a niece, you have a cousin, you have a younger sister who is going into perimenopause or who needs to be educated on the transition that's coming. Bring them to the summit. Perimenopause starts 35 potentially or older.
Yeah.
Not 45 and older. So be educated, be aware so that you can be empowered.
I'm glad you said that.
Yes.
Because when you think about menopause, automatically you're thinking 40, 45 to older. So when you're young in your 30s, you're not thinking, I need to be at a menopause awareness summit.
Exactly.
And I will say from experience, when I was in my 30s, I wish I had this information because it's something that's going to naturally happen to all women and you need to be educated and prepared for it. So I am glad that you are here and you are a part of Beating Heart Health for Women because you are the bridge for your demographic. They come to you, you give them the knowledge and empower and bridge over to us. They come to us, we bridge them to you because your hormones, if you need to understand, did you hear this? I've never had a conversation with a pharmacist that was this informative. Just breaking it down, what's happening in our bodies, how your hormones work. I mean, this was amazing. So I want to thank you.
Thank y'all.
You will come again and again and again and again. So ladies, this was amazing. And you know what I always say, I wish you happy hormones, ladies. Thank you for rocking with us with MenoTheSis, Dr. Jess, and Veronica. Hey, girls. Hey.
MenoTheSis.